I'm Dr. Ian Gardner. I'm the director of the Advanced Breast Imaging Program at the Canada Diagnostic Centre in Vancouver, British Columbia. Today I'd like to share a few breast MRI cases with you and show some of the features of CAD software. Let's start by looking at our desktop. When you open up your CAD system, you will see a list of all the patients that you've imaged recently. Click on the patient that you want to analyze at the moment. When you do that, the images will pop up onto your screen. Now, the first thing that I like to do is look at my MIP collection. This, I find, gives me a good sense of the lay of the land. I'd just like to know where things are with this particular patient. By the way, this patient was in her mid-50s. She had just been diagnosed with invasive ductal carcinoma in her left breast, and she was presenting for a staging breast MRI. So the clinical question here is there any burden of disease elsewhere, either in the same breast or in the contralateral breast? Well, we can see the index lesion on the left side fine. So let's throw our angiogenesis map on. I'll come up to the upper left-hand corner here and click on this icon, which brings up the angiogenesis map and superimposes it on top of the MIP images. Now, sure, we have the index lesion in the left, but notice that we have two other areas of concern on the right side. We don't want to rely on the angiogenesis map to find these lesions, but this is one way that we can identify them. So let's start by looking at the more anterior of the two lesions here in the right breast. Now, if I wanted to, I could bring up all of the tools that I would need to analyze this, including the level and window function, the zoom and magnification, pan view, annotation, and ruler function. I get these tools by right-clicking, which brings up this toolbox for me. Now, I could do it all manually, or there's an easier way. All I have to do is put my cursor over the lesion of interest and click once with my left button. And when I do that, the computer automatically calculates all the data that I need for this particular lesion, starting with its location and size, with a bunch of icons showing me where it is in 3 different planes, plus the dimensions to anatomical landmarks and the size of the lesion itself. The next thing we want to do is we want to assess the morphology of the lesion, because that's where the bulk of our diagnoses are coming from. So I click on the morphology function here, and it brings up the various different descriptors that we need to record when we're following the BI-RADS protocol and their terminology. So this is a mass. It has an irregular shape with irregular margins and a heterogeneous enhancement pattern. Once I'm finished assessing the morphology, then I'll move on to kinetics. The computer will find the worst curve within this mass automatically for us, so I don't have to go back and forth with a small region of interest trying to find the worst curve. Not only does it find the worst curve, it also shows me precisely where it's located in relation to the mass, and that way I can be certain that the worst curve is associated with the mass rather than with a blood vessel that just happens to be next to the mass. So once I've assessed the morphology and kinetics, the next thing that I will do is I will assign a BI-RADS category to it, and in this case I'm going to select BI-RADS category 5 from the drop-down menu, because I would like this second lesion to be biopsied before the patient has any definitive treatment. Now, that's going to be done, at least in our practice, under second look ultrasound. In order to convey the information to our ultrasound technologists, I'm going to show you the portfolio function of the software. This will create a PDF file that lists all of the lesions that I have identified. Now, so far I've only interrogated one. But on the first page, we will see a summary of the various different lesions. In this case, there's only one so far. On the second page, we'll get detailed information about that lesion, precisely where it is. And these icons right here, along with the anatomical information, can be very helpful to your ultrasound technologists when they're performing a second look ultrasound.